Hi there. I'm Robin Powley. I would like to introduce myself before I start this workshop. I have a master's degree in special education and emotional and behavior disorders. I later obtained a national board certification um, after working in schools for 20 years as a behavior analyst at Antioch. I left the public school systems after 20 years to go into private practice, contracting to public schools. I then started completing, while I was working in public schools, completing independent education evaluations for families and for schools. One of my favorite parts about being a BCBA is being a parent coach. Parents are eager to help their children and follow treatment plans, and that's really a rewarding part of what I do. So, this is a workshop on trauma-informed strategies for behavior support plans in educational settings. It's a comprehensive course designed for board certified behavior analysts and RBTs seeking to deepen their understanding of trauma-informed practices and their applications in support plans in schools. Education, these are in educational settings. Participants are going to explore the impact of trauma on students' behavior, learn evidence-based strategies for trauma-informed care, and develop skills necessary to create supportive environments that promote healing, resilience, and positive behavior outcomes. I'm going to break this workshop up into 3 sections. The beginning is going to just be talking about what does a trauma-informed school look like, and what information do you need to be thinking about when you're thinking about trauma-informed ABA in a school. The second part is going to be talking about how do you perform a functional behavior assessment with a trauma-informed lens in a school setting. And then lastly, talking about that behavior support plan and what does that look like, and to give you some strategies on some different ways of looking at putting this plan together. I'm going to reference Greg Hanley's My Way and give you some examples of that. And I'm going to talk about preschool, elementary school, middle school, and high school. So the course outcomes: conducting trauma-informed functional behavior assessments to identify triggers and maintainers of challenging behaviors, integrating trauma-informed principles with evidence-based behavior support techniques in schools, engaging in collaborative problem solving with school staff, administration, and stakeholders. And lastly, analyzing real life case studies to develop trauma-informed behavior support plans. Along the way, I'm going to share some experiences I've had with students of all different levels who have experienced trauma, and some of the strategies that we've used to help change the way we are working with students in schools based on their trauma background. So, best intentions. We all go into this field because we do have great intentions. Picture that teacher who meets the students in the hallway with a big hug. And I ask you, will love solve the problems? Will love solve all the problems? And anyone working in schools wants the best for their students. Our goal is to guide our students in the right direction, all the while teaching math, reading, social studies, science, and so much more. We all know that there's a 6.5 hour school day where we have to pack in so much, and we have to acknowledge who's coming into the doors every day. We walk into the buildings to create relationships. We know that pairing ourselves with reinforcement helps us to be more successful in changing behaviors. Every day, students enter the classroom with backpacks and pencils and papers and their unique view of the world. These views come from past history, their own expectations, their home life, their community, and their school experience. Teachers recognize and try to respond to all the diverse needs of their students. Everybody comes in carrying some kind of rock as that they need to work through. When students walk into the classroom with a history of violence or neglect, they believe the world is unpredictable and a threatening place. As trusted adults in schools, we should never underestimate the power of strong connections and relationships with students and families. I'll just share a quick story with you. It was pouring down rain one day, and I was driving to a middle school. And I was about 4 miles out, and I saw one of my students walking to school, and it was just downpouring. He was soaking wet, and I wasn't thinking fully. I thought, what is he doing walking to school? In retrospect, I should have called the police. But luckily, a police officer did pick him up and drive him to school. And uh, the guidance counselor walked him up to my room, which is a resource room. And she had thrown his sweatshirt into the dryer. He was still soaked. There was nobody home for a change of clothes. He sat, I gave him some hot chocolate, and there he went off to class. And I thought, wow, that just happened in his morning. That's his morning. It turns out that he had a fight with his mother and left the house and took a wrong turn. And it ended up being about 4 miles for him to walk to school. And there he went to his social studies, his science, his English, math classes, right? And um, with the expectation of learning. I know for me, if that rain was coming down so hard, walking from my car to the building was aversive to me. And this poor eighth grader was now expected to learn. We are mandatory reporters when we work in schools and clinics. It's important to talk to your coordinator, guidance counselor, principal to make that call together. Obviously, you can make that call on your own, but schools like to document these pieces within their paperwork so that there's a record of what things have been done from the school. But that's just one example of a setting event that's happened before a student's even walked into the building. And had I not seen him walking to school that morning and the guidance counselor, I hadn't been in the room, I wouldn't have known any of this had happened. Um, that's a big deal. So child maltreatment. Child maltreatment is commonly divided into 5 main subtypes. The definition of child maltreatment is any non-accidental behavior by parents, caregivers, or adults or older adolescents that are outside the norms of conduct and entail a substantial risk of causing physical or emotional harm to a child or a young person. These are physical abuse, emotional maltreatment, neglect, sexual abuse, and exposure to family violence. These behaviors may be intentional or unintentional, and they can include acts of omission, which is neglect, and commission, which is abuse. Treatment of trauma can be beyond our scope of competency as a BCBA. I'm presenting this workshop as a BCBA and not a mental health provider. There are other workshops that are presented by mental health providers on trauma. However, identification and of risk and and protective factors can be used to help develop targeted approaches to reduce abuse and neglect. Strong protective factors in families, such as supportive social networks and good parent-child attachment and engagement with education, can also build resilience in children and parents. Those are within our scope of competency. I love this quote. It's from Dr. Bruce Perry. He is a leader in trauma and also works with schools after school shootings and traumatic events. He talks about shifting that focus from what's wrong with you to what's happened to you. And I really like that way of thinking. Because we know that young people who have experienced trauma struggle socially in school, get lower grades, and are more likely to be expelled or suspended. These students are more likely to be identified with an emotional and behavior disorder and become involved in the child welfare system and juvenile justice system. Schools have a huge role in trauma-informed care. Students are with us for 6.5 hours a day, and that's a large amount of their time and a huge responsibility. So, um, however, when I was in school, it was a long time ago, um, we didn't have a dedicated preparation course in understanding the impacts of trauma and then how to change our practices to meet the needs of students. It was a different time. Um, Even when I went back to school later for to become a behavior analyst, there was not a lot of discussion about trauma-informed care. We know that applied behavior analysis is all individualized, which implies that it's trauma-informed because we're dealing with individuals. But trauma-informed education as a school-wide system that recognizes the prevalence of adverse and traumatic childhood experiences will equip teachers and staff with knowledge to really recognize trauma and build strategies to support students who experience trauma. Um, you don't have to be in special education to have had trauma in your life. This is why it's broader than special education. The impacts of trauma can be pervasive and take many forms. So, the way a child who experienced trauma can be pervasive, and the way they present themselves may mask rather than reveal their difficulties. So, what's trauma? Trauma is not an event itself, but a response to a stressful experience in which a person's ability to cope is dramatically undermined. Every traumatic experience is different, and each child's response depends on the context and circumstances the event occurs. That's a pretty simple definition of trauma. I'm not going to go into a lot of detail about the adverse childhood events, but there are so many resources on this topic, and that's really how you start to identify a child with a traumatic event based on their adverse childhood events. But the goal of this workshop is going to be working with students in the school system. The first thing we must do is understand the function. Researchers tell us that if we build children up in 4 key domains, relationships with teachers and peers, self-regulation of behavior, emotions and attention, success in academics and non-academic areas, and physical and emotional health and well-being, we can really maximize these students' opportunities to overcome adversity and to succeed in school. So understand the function. We know that behavior is communication. We know that understanding the history of a student helps inform our expectations in terms of functioning, classroom management, and school environment. And what can we do to the environment to minimize triggers and support the student? I have a lot of question marks here. We must know what a child is seeking and what are they trying to get away from. So we know that some examples of supports in schools are rest times, built-in snack times that occur all day long, breakfast clubs, just among other things that we'll discuss later in slides. But I have 2 examples of students that just had some difficulties this past week based on some past trauma. One is a young man who's in 7th grade. I started with this district at the beginning of the school year, 1 day a week, and I with a more disabled population, and then moved into a population of students who'd exhibited a lot of behavior to try to build the program. And this is a student who, since I have met him in February, has worn the same 2 sweatshirts over each other since February, every single day. And so when I first met him, we can call him John. When I first met John, it was time for him to have his evaluation. He had a identification of emotional disabilities. The evaluation showed that he had significant language learning disabilities, and he lived with his grandmother. He had had some abuse from family members, and was estranged from them, still seeing them, there was always conversations back and forth about who was trying to get custody, and he was in the middle of this. And he had a very strong support system from his grandmother, who he lives with. And for the last, so we put together a program for him with a lot of support and specialized instruction to address the learning difficulties, and he started to experience success. In the last 2 weeks, things have really fallen apart. He used to just come to school with one ear pod and listen to music and he had his hood on, and we let those things happen for him. There's always these crazy school rules about taking your hood off, and I get it. I understand why we do that, but we also have some students who really need to be able to wear their hoods. And depending on the school I'm at, they could end up getting an after school detention for wearing their hood in the hallway. This school is not like that. But he stopped attending classes and put his head on the desk and for a whole week refused to do anything. And we can't make anybody do anything, right? We can just we change the environment for them. So we started wearing both ear pods, and well, you can't really learn at all. You can't hear anything else. And he had his iPad with him every day. And I was in constant communication with his grandmother. I asked her to maybe just send in one ear pod and maybe not send in the iPad. She communicated with me that if she didn't send the iPad in, he wouldn't come to school. And I said, absolutely, send him to school. He has to come to school. And we would support him the best way we could in school. So lots of communication and lots of support systems within the school. There was a truancy officer who worked with him. I imagine he had past truancy issues, and he had has a counselor at school. So the day that I saw him, this past week when I saw him, Mother's Day was coming up, and he was had some pretty interfering behaviors, non-compliant, little aggression, some property destruction, eloping. And on Friday, he eloped. And he's a student who also has self-harm. So he will scratch himself, threaten to hurt himself. A lot of it seems attention getting, but I don't ever dismiss these behaviors because I don't know what will happen. And so even though self-harm can be attention getting, it's still a very important behavior to address. So he had eloped, and he is not one who will just go to one place and then show up somewhere else, because we've had students, obviously you address it with the function of the behavior, right? If you have a student who's eloping for attention, the last thing you want to do is give them attention. He was a little bit more, there was more to this student because he had a trauma background. So I did reach out to administration, and we checked bathrooms, and he was in the nurse, and he ended up coming back to the classroom and went into the back room. I decided to lighten his load in terms of he was starting to worry about his classes. According to his grandmother, he was failing 2 classes, and he was also scheduled for an art class that he never had yet attended. So I dropped his art class and went into the back room, and his head was down. I don't know if he had his 2 headphones in or not, but I said that I had dropped his art class to take that pressure off of him. I want to, these are students whose cups are running over constantly. And so what can I do to release some of that, the run over, so that he can do the best he can and be the most successful in school. I also told him that he didn't have to go to classes that day. And I also modified some of the work that he had to do, because we know that self-fulfilling prophecy of, oh my goodness, I'm failing, that circular reasoning, right? I'm failing. If I don't do my work, I'm going to fail. So I'm not going to do my work. So I said, you know what? I'm going to leave you alone. When you're ready, just crack open the door and somebody will come in to help you. So it took about 2 hours, maybe 3 hours, and he was ready. And he has a really close relationship with one of the male support staff in the room. And he went in, and the more work they got done, the more successful he felt. And by the end of the day, he came out, his whole affect had changed. When he left, he said, "Goodbye, have a good weekend. I'll see you next week," which was more than he had said in 2 weeks. Um, the other example was a student who, again, um, I came into this room with a very angry father who had called the superintendent. The student was causing significant behavioral disruptions in every single class, swearing, refusing to leave when asked to leave, getting into a lot of trouble. And I had an IEP that didn't really tell me much. And I had a very upset father, got some history from him that the mother had it was not in this child's life. And as I got to know her throughout the months of February to now, um, she shared information about her mother. She really bonded with one of the support staff in the classroom. And I was also able to lighten her load, her academic load, so that she was in more appropriate classes. I got a lot of pushback from this from teachers, but a lot of people saw this as just plain old refusal. She is just refusing. She is just a behavior problem. But there was a lot more there when I did some digging. One, she had significant learning disabilities, and two, she's had significant trauma. And in the last week, she has refused to do things. We had really worked on some coping strategies. So instead of eloping, I said, it is okay for you to not want to do anything, but you can't just be walking around a school. So instead, come in, go to the back room. That's the message to me and to the staff that you need time alone, and we will honor that. She did that, which was wonderful. After some time, I went in, I sat on the floor. I said, "I'm really sorry." Her dad had shared with me that she was really struggling over Mother's Day because she was starting to realize that she hadn't seen her mother since Thanksgiving, and her mother really wasn't going to be part of her life. How do you how do you learn social studies and science and math and English with all of this on your shoulders as a kid? I mean, as an adult, it's hard, but as a kid. And so I also told her that we were going to modify some of her work, and that she was instantly open to working. I sat on the floor in a dark room with her, and started to work with her. I didn't talk about her trauma. I didn't talk about her mother. I just said, "Here, let me help you do this." Um, and by the end of the day, she had moved out of that room, had completed work, was so kind, was playing Uno. And again, I was able to write to her father about the success she had that day. But I had to look at their histories to better understand what was occurring. And schools can meet these needs if we foster a culture of acceptance and tolerance where all students feel welcomed and taught to respect the needs of others. Um, we need to have individual support and policies that do not pull students away from their peers and trusted adults. Had I not looked at the history, had I just trusted the documents in front of me, these students would be living in the principal's office and would be failing. There, no doubt about it, they would be failing. They were failing when I walked in. It doesn't make me some amazing person. I just dug a little deeper. So just like we were talking about, trauma can impact school performance, lower academic achievement and grades, higher rates of school absences. I'm going to talk a lot about school refusal here. I know that's an issue that a lot of BCBAs are dealing with now. Increased dropouts, more suspensions and expulsions, decreased reading ability. Trauma can impair learning. Concentration and memory are affected. And early years of trauma may affect attention, memory, and cognition. Um, these are types of issues in schools, and they cause professionals to seek the support of BCBAs. And our role is to use positive behavior supports in a proactive and preventative approach. This is a continuum of support from least restrictive to most restrictive. And that's why we have different tiers. Tier 1 is for all students. Tier 2 is for those who need just a little bit more support. And tier 3 is who need the most support. Our job is to use behavioral strategies that are based in evidence. However, children in schools, they're with trauma are our most troubled students and will need a different approach of care. How do educators support children with trauma in the school context? There's a lot to accomplish. We obviously all have individual roles. As adults in the school, the teacher's role is to educate them on their subject matter. Speech pathologist is to work on pragmatics, communication, articulation, language. We all have different roles, and it's important that we work together. And I don't say that lightly, because as I was telling you about my other story, I had reached out to the teachers of these two students who struggled, and I got some unhappy responses of anger from teachers who really didn't believe that this was really happening to them, that they were just didn't want to do work. So trauma-informed practice can be viewed from both a deficit perspective and a strength perspective. We know that reinforcement involves consequences that strengthen behavior. To strengthen a behavior means to increase the likelihood that it's going to occur again in the future. I wanted to add reinforcement to these two students that day as an example, and that reinforcement looks very different than reinforcement would look for a typical student who hasn't experienced trauma, right? I took away some pieces, some consequences, so they could strengthen their appropriate behavior. I wanted to increase the likelihood that they would do the work again in the future. So in order to do that, I had to remove some things. I removed art from John's schedule. So we really need to look at a strength-based approach to students' abilities and promote and guide students with trauma backgrounds towards success. So in order to do this, we are doing preference assessments. A lot of times reinforcement is aversive to students who have experienced trauma, but we do all these things within our FBA. We find out what a student likes, who are their trusted adults in the building, and what are their academic strengths. So trauma-informed ABA. When a child shows behavior difficulties and has experienced an impactful traumatic event in the past, a sensitive, individualized approach to our treatment is needed. It's a little bit different than the definition, right, of applied behavior analysis, what we do in terms of changing socially significant behavior. Trauma-informed ABA has a little bit of a different definition. It still means, though, that we work in an evidence-based therapeutic way that aims to increase positive behaviors and reduce negative behaviors that might interfere with daily activities. Trauma-informed care in ABA recognizes, though, the profound impact that these experiences have on individuals, and it provides a compassionate, healing-oriented, and holistic approach to behavior therapy. So barriers for behavior analysts. In 2022, in the Journal of Applied Behavior Analysis, they state that despite the growing acknowledgement of the importance of understanding the impacts of trauma on therapeutic approaches across human service disciplines, these discussions have been relatively infrequent in the behavior analytic literature. There's a lot in mental health literature, but not a lot in behavior analytic terms. BCBAs have difficulty with that concept of trauma. It's so broad, and we have to really, and we're used to interpreting things in behavior analytic terms, and that's not always the case here. So as with physical trauma, the causes of psychological trauma are extrinsic to the person. We have to acknowledge that complex learning histories are happening with our students, and we have to focus on current contingencies. The effect of experiencing traumatic events is conceptualized as an internal response, a private event. We know that private events occur. We believe that they occur. We know they occur based on our research, and they occur based on an aversive external event. We are pragmatic people in this field, and the focus of feelings or perceptions of experiences are somewhat uncomfortable territories for BCBAs. And I think we get a bad rap a lot in this field of ABA, and it's our job to promote ABA and let people understand that we are not so rigid. It's why it's so important that we don't use behavior analytic terms when we're working with people in schools. It makes us look above others, and that's not where we want to be. We want to not look so rigid in our thinking. But we're still pragmatic people, right? We look at evidence and we want something that we can observe and manipulate. So Bellini defines a skill acquisition deficit as the absence of a particular skill or behavior. I use a table like this often when I'm working with staff. I think it's just really clear and succinct for people, and it's just really concrete. So this means a skill deficit is the individual does not know how to perform a particular skill. They just don't have it in their repertoire. On the other hand, he describes a performance deficit as a skill or behavior that is present, but not demonstrated or performed. It's in somebody's repertoire, but they're not using it. Those are very different. And how we approach that person and that deficit will look different. Many times students are communicating their unmet needs or unprocessed feelings or private events. This leaves students with deficits in skills to seek out appropriate support. We have some students who really don't, there's an absence of that particular skill. So I break this down because when I'm working with students, it really helps teachers to understand that maybe this isn't something they know. Maybe those teachers, again, who were thinking that they are just refusing and not wanting to do the work. Maybe we need to break this up, right? Is it a skill deficit or performance deficit? So both involve instruction. So this means that the student who's defiant or oppositional may in fact not have the ability to appropriately communicate their needs. This is where functional communication comes in. It looks different for students at different ages. I just have two examples here. One is using functional communication in elementary school. We often hear people in elementary saying, "What should you say? What do you need? Say what you need." And that's the assumption that this is a performance deficit, that this is a student who has the skill, but they're not demonstrating it. That's us making an assumption. I would rather lean on the side of let's teach the skill at the same time. So not using carrier phrases like please or I need or can I. I feed the words to the student. You can say I need a break. You can say break. You can use a card. You can show a card that says break on it. But we are teaching them that skill with the assumption that maybe that there's an absence, especially with students who have experienced trauma. They may not even have ever learned that skill. In middle school, we say it's okay to be mad at me for asking you to do work. Instead of swearing at me or leaving the classroom, I give them the strategy instead of saying, you need to come up with another way of handling your swearing or your anger. I come up with strategies. Sometimes this is the work that a school psychologist will have when they're working with the student in collaboration with me. With the student I talked about who's hadn't seen her mother, we had established that there will be no consequence to her if she opens the door and just goes into the back room and says nothing. That is the sign that to be left alone. That's functional communication. She can be in that back room alone. That replaced the behavior of eloping. And so that taught me that she has this skill and she wasn't demonstrating it. So that's okay. Now she's using it. So it looks different for different students. It's our job to understand the context of the child, both in and out of the school environment. And again, this is where an FBA comes in. We're going to learn to interpret the function and meaning of behaviors and disengagement. So research from a 2017 study notes that even though we as BCBAs are asking questions about an individual's history, as it states in the BACB, assessments include gathering history and what information regarding one's history, those remote contingencies, what affects the conclusions drawn from those functional assessment results. But we're not routinely asking about details regarding trauma. An example of this is having a behavior analyst know that a child has experienced neglect before they were placed in a foster home. The assessment or analysis confirms that adult attention might reinforce aggression, right? So when adults giving somebody attention, they're aggressive. This may be a sign that there may be some trauma. What makes trauma-informed care different is that we're going to take the history into account rather than the immediate contingencies. We're not going to be able to solve all the problems with ABA alone. And this is where working with others collaboratively are going to be essential. We as BCBAs are highly effective in evidence-based strategies that achieve results for most children. Children with trauma are not most children. However, working as a team is the best approach to supporting students in the school environment. Using the principles of behavior analysis and positive behavior support does expand that multi-tiered structure that caters to students across different levels of support. But ABA alone is not enough to support students with trauma. That current research says it's not enough. And I will say that even after 20 years in schools, once I learned everything I did about ABA, I was so gung-ho as a new behavior analyst that I had difficulty working with people who were working using programming that was not based on empirical research. I had a really difficult time with it. I saw how ABA worked. We all learned in our classes what was based on research and what wasn't based on research. And a lot of things that they do in schools are not based on empirical evidence. However, it's our job to work with others and play nice in the sandbox. And it's our job to work with these other programs that may not be based in evidence and create and work together. Maybe we add some behavior analytics to those. One that comes to mind is social thinking, the social thinking curriculum. Nothing wrong with it. It's not based on empirical evidence. All the research that was done for this curriculum was done by the author. And however, there's a way to make it measurable and behavior analytic and defining the colors. And so it's working together on things to really best support these students who've experienced trauma with the other strategies people are using. And again, we need to stay within our scope of competency. So trauma-informed care versus trauma-specific services. So trauma-specific services are individualized clinical interventions designed to directly address trauma-related symptoms. So those are specific sets of reactive strategies and interventions. A therapist may be doing that with the student. Trauma-informed care refers to a broadly universal approach. It's a proactive, preventative approach. So even though behavior analysts are like analysis is likely a good place to contribute to both approaches, we're going to focus on that trauma-informed care in the schools. And we leave trauma-specific services to mental health providers. So, I'm a geek. After I went to school for education, I went back to school to become a social worker. I love school. Um, I had spent years in education already, and I completed much of the program. But I'm not going to lie, being in the classes always reminded me of a therapy session. I kept looking around, thinking everybody here is talking about all their problems. I was kind of annoyed, to be honest. I thought maybe I should go into policy work. I ended up not finishing the program, and I later, I mean, this was in the late 90s, and then I later went back to get my board certification in behavior analysis, and I loved ABA instantly because everything we do is based on research. And I always tell clients or families that I'm this super emotional person because I am, but my emotions don't go into any decisions. Data and evidence are the basis of our decisions. So Maynard et al. Conducted a systematic review of trauma-informed care in schools, and they failed to produce a single study with a rigorous enough research design to meet the inclusion criteria. That's in today's world, it's really hard. These are hard pills to swallow for BCBAs because they're not grounded in the empirical evidence that we're talking about. However, this is exactly why our field is necessary in the contribution to trauma-informed care in schools. For those of you who are already in schools, you know the challenge that classroom management is. It's the universal challenge for teachers. It keeps us employed. It's also the primary reason teachers are leaving the profession. The more stressed out a teacher is, the more reactive they are in using behavior management strategies that are punitive. We do tend to be in a punitive society, and that is something that happens in schools. And it's something that it is, I feel like it's part of our responsibility to help change. So the disruptive student. We know that reactive strategies are used in response to a disruptive behavior, and proactive strategies are used to prevent them from occurring. And we also know that disruptive students in the classroom are stressors for not only the teacher, but for other students. We don't know what other trauma those other students in the classroom have had that these other students are triggering. Traditional techniques, which we have now, such as zero tolerance policies in schools, are really problematic for students with trauma. They exacerbate behavior problems. A study done a long time ago in 1989 recommended group management skills to look at disruptive behavior. It also allowed teachers to create relationships with their students. So interestingly enough, and maybe not so interestingly enough, there's a lot of reactive strategies being used. Students are confronted, especially those when students are confronted and they have a history of trauma. Not only is that individual re-traumatized and affected, the whole class is affected. I want to share an experience I had going into a house of a student who has missed 158 days of school. She went to school on the first day, and she had a hard time finding her classes. This is a very big middle school, and they're given a schedule. We don't know them when they come in. They all just come in. Doesn't have an IEP, so she wasn't on anybody's radar. It's a new school. It's a 7th and 8th grade. She was coming in as a 7th grader and went to her classes, had a really hard time finding them. The schedules are crazy. And when she went to the classes, they were doing getting to know you activities where you had to stand up. You're really putting yourself in a vulnerable situation. Finding something alike with another student is just really hard for some students. And this student stopped coming to school. That was the only full day of school she had. She loves art, and she ended up liking the librarian. So she started to come to school just for art and the library. And that was an average of once a week. Um, Unfortunately, nothing, the school really didn't do much about this at the beginning of the school year. And the family went to a hospital to have a pediatrician do a full history. She was diagnosed with generalized anxiety and high functioning autism is a secondary, but students still didn't come to school. Parents made a referral for special education. You can't really do, I mean, they can do that, but we don't know how this student was performing in regular education. So we can't really say that she needs specialized instruction if she hasn't shown that she can even do she can't do the general education curriculum. And they did propose testing, but she did not show up to school for testing, yet continued to not show up for school. And what nobody really called DCYF. She just went without coming to school. The truancy officer was involved very little. There's a lot of regular ed support, but there was really no person who was in charge. So there was no touch point. There was not one person who was in charge of leading this whole case. And so come May, the special ed director told the principal he had to call DCYF and write a letter to the families saying, because the family was calling her in every day, saying that she had anxiety. And so I, as the BCBA consultant, was asked to go to the home to see how we can use some positive interventions to get her to come to school. What was preventing her from coming to school? And so the parents were really worried when I said that I asked if I could come. They canceled once. I was worried they'd cancel again. They were very worried. And I finally went to the house, and she met me there. The parents definitely reinforced the anxiety. They had another child who had never left, who was 23 and didn't leave his room and had selective mutism, or I didn't get to meet him. But I asked her very clearly and specifically, I wanted her part of the conversation, why she didn't come back. And she said, I didn't like how the teachers spoke to the students who were not listening. I felt like they were being mean. It made me anxious. And so I decided, I looked at this as a student who, one, had significant anxiety, and how do we get her back into school slowly, right? This is where I could use my behavior analytics skills and make some recommendations and then hand it over to regular education. And this is where that tier system comes in, and that she is not a level tier 3. Had these things happened in September, we'd have probably a different outcome. But we talked about a phase system. How do we phase her back into school slowly? And I'm gonna give you some examples of that when we talk about school refusal. And this is a school refusal case. And so it was building on success. So coming in, my plan was come in on Tuesdays, advisory, art, and then let's add English and language arts. But that was the teacher she felt most comfortable with. I really, it was a student first, student centered approach. What are you comfortable with? Let's have a touch point in the building. Let's have a safe place to go, and let's build off of success. And that's where we talk about a strength-based approach. So are there unteachable students? I have heard teachers talk about the students who they can't teach. I've heard it in all grade levels. This is a student who's never going to learn anything. I've heard it from preschool on. They're never going to be able to learn anything. There's an assumption that students will trust their teachers' good intentions, right? I mean, why else would they be teachers, right? But we know there's no quick solutions. And we also know that individuals who've experienced trauma have learned through their experiences not to trust other people. So that safety and predictability that a school offers is so different when they're living in chaos. And they may be testing the boundaries and the resources of the school. And their behaviors have developed as a response to the situations that have occurred outside of school. These behaviors, though, are not tolerated within a school system. So when we're brought into a situation where a student is exhibiting behaviors, we have to be so very cautious to not make our own assumptions of what will or will not work based on our experience. Um, once you've been doing this for a while, you think, I know how to work with this student or a student like this. And that is making an assumption. And these are students that rewards may not work for. And they're often the students who are the first to be placed in out of district placements. We know that these students come to school with fears and anxieties, and they walk into a setting with boundaries and safe places. We also know anxiety and fear look different for every person. The behavioral definition is going to look different for students who have experienced trauma. Your anxiety may look different than my anxiety. So we have to find the behavioral definition of what your anxiety or that student's anxiety or fear looks like and put some context to it. So defining these appropriately and accurately when looking at the functions of behavior are going to be really important. So let's say the tone of a teacher's voice or something about the setting evokes an interfering behavior in a student. That's our job to look at. Then the student gets disciplined for a behavior that may be out of their cognitive control. And this then escalates behavior. This is a popular strategy in schools. And we know behaviors can underpin learning and processing difficulties that are real. These are things that happen when, especially in those early years, when trauma occurs. In those very early years, they have a greater effect. I once had two twins who were adopted at 2 weeks old from a reservation out west to a lovely family, and they had a wonderful upbringing and ended up having such significant difficulties, both of them, in schools. And I was brought into their home by an outside agency as a BCBA, and their behaviors at home were so very unsafe. One of the sisters was sexually molesting the other sister, and they were threatening the parents with knives. Um, one we had the mental health systems are broken. There was mental health providers involved. DCYF was involved. There's also so much they can do. The solution for the sister who was sexually molesting the other sister was to have an alarm on her door so that the parents could hear what was happening if the sister left the room. Both of these girls were already placed in out of district placements. And it was a really sad case. They both had processing and learning difficulties that those emotional and behavior disorders, those emotional and behavioral the behaviors masked their processing and learning difficulties. And the schools were looking at their behaviors and not always their learning because their behaviors were so overt. Sadly, this didn't end well. One of the girls ended up dying of a drug overdose years later, and very tragic. The parents got a divorce. It's just it's so tragic. And these were girls that were born to a mother who used drugs, but they were adopted at 2 weeks old. And it just goes to show the what trauma can do at those early formative years, as opposed to later years. Not that trauma is bad all around, but what early trauma can do to a brain. So if you have a processing disorder and it affects your learning, you're a student that's identified with a specific learning disability, and it precludes you from being identified with an emotional and behavior disorder. Does not mean you don't have behaviors. It just means, where are we putting our focus in terms of specially designed instruction, so that we are building skills, so that these are not performance deficits. Whereas, you have a student with an emotional and behavior disorder, they're they have some performance deficits. They may have some skills. They may be strong readers and writers. They're just not using the skill. Whereas if you have a specific learning disability, you have a skill deficit. And if you're just addressing the behavior and not the skill deficit, we are doing an injustice to that student. Trauma affects brain development. A study done by Geddes states that learning difficulties can be understood as a symptom of the child's state of mind and experience. And if we do not recognize the learning difficulties of these students, behaviors will escalate and instructional time is lost for that individual. And we know that the longer that you're in school without those learning difficulties being addressed, the harder it is for them to learn them. So this leaves us with a huge responsibility. So we know that the teacher who understands the antecedents of a situation can change an individual's experience. So I want to pose a question to you. Do you agree that behavior is learned and can be improved? So think about the learners you've worked with and the ones you've had great success with, and those that continue to be a challenge. What we believe and about why behaviors are occurring governs our interventions. We follow the data, but we're human beings, right? That's who we are first. As we should be, we shouldn't turn off these feelings. We have opinions. And honestly, we don't want to be rigid behavior analysts. And I'm not saying that we don't follow the data. But we also have to look at what our beliefs are, what our pre-existing beliefs are that may have influence over our decisions. What's within our control here? Those are pieces about parents, and people are often thinking a lot about, well, it's the parents' fault and it's the home, it's what's happening in the home. That's why they're like this. And parents do the best they can, and we cannot control what happens in somebody's home. We cannot. And this happens so often, the blaming of parents. And yes, are there parents who have not done what's right for their children? Yes, absolutely. There are teachers who have not done what's right for their students. But the assumption is that we are all doing the best that we can. I recently, on another note, when we're looking at this pie graph, when we're looking at an FBA, when we're looking at environment and behavior, always, we also are looking at their histories, their significance, and related risk factors. As a behavior analyst, right, we are also looking at what's in front of us. And I recently completed an independent educational evaluation for a family who was taking a district to due process for an 18-year-old. The district hired another BCBA, as within their rights, to do an evaluation. They hadn't done one yet, and he was 18. That was a problem. But when I read the report, I felt satisfaction that the report, although written an entirely different way than mine, came out with the same conclusions. So, that means that two people are looking at a situation, and we are looking at what's happening and occurring across all of this student settings and 18 years of history, and coming out with the same conclusions. That to me is very positive. And going back to our own assumptions, we have beliefs that are called faulty explanations. And how often, right, have you heard a teacher, I hear it all the time, or staff members say something about the student's family or a sibling who acted similarly? Oh, I had their brother was the same way. Oh no, they have another brother coming in. These are faulty explanations all over the schools. There's an assumption that all of the students in the family are going to be the same way. Schools are communities, right? they are little microcosms of our world. And we know that teachers talk from year to year about the students who are coming to their class the following year. It's hard to stop that train once it's taken off about a student. There's a lot of preconceived notions that if a student has have all these behavioral outbursts one year, they're going to have them the following year. But these faulty explanations do not help resolve situations happening in classrooms where behavior is affecting learning and teaching. What does not help are the beliefs that the child is just bad or that they just don't like the teacher. We can't change the student's classroom teacher due to a behavior. You can't write in the plan change teacher or try to put them in a classroom with peers that they're not going to be have issues with. The world does not work that way, and schools do not work that way. We also can't blame a disability. All people with disabilities are individuals, and we cannot assume that those with the same disability will act the same way. So too often a student has a behavior, and the first thing school staff do is refer them to special ed. Disabilities do not go away, but we can teach about the disability and characteristics, and in some case, the triggers. So I did talk a little bit about circular reasoning. If you remember, A equals B, B equals A. Robin can't sit still because she has ADHD, and Robin is ADHD, therefore she cannot sit still. Nothing gets accomplished with circular reasoning. And we hear that all the time. Well, if they could just be put on medication, it will change their behavior. And I always say that medication is not going to change behavior. It allows students to be open to interventions. As I mentioned, another thing that comes up a lot is parenting. And there are, as I said, circumstances where trauma has occurred due to parental circumstances, but we need to know those circumstances. And our job as a school BCBA is to help change the behavior in the school setting. So we can do very little to change home life. We can use the knowledge from home life, as mentioned in this bar graph, their histories, to inform our support for the student. And we do this by digging a little bit deeper into the child's history, and knowing what is impacting a child's behavior outside of school helps us build a better understanding of how to work with the student in school. We have to remember what is within our control. So a lot of history that applies to trauma-informed care and ABAs on this board here, but not the two dogs. So I have another story. When my husband was in first grade, he was walking down the street, and a huge dog, or he says was a huge dog, started to chase him, and he climbed up a street sign. I think it's funny that he climbed up a street sign, and I can just picture him sitting up on a street sign, and he stayed there until someone found him. That was an event that created trauma for him. And he happened to have married a dog person. And we had all these agreements when we got married about like what we were going to do in our marriages. We've come from different backgrounds, and it was kind of a business sort of agreement. And one of the things in our marriage that we agreed on was that we would always have dogs. I said dogs. He, 21 years later, says I said dog, but we have two dogs, and those are our two dogs. And when we started dating, I had one dog that had been in 3 different homes. That dog had a traumatic history and was pretty protective over me. I did not help the matter. And we were going to see a behavioralist, working on the dog skills a lot, doing as much as we could to help this dog, was attacking other dogs, doing some crazy things. That's another workshop. So when I was pregnant with my oldest son, we were working with the trainer for one of our dogs, and we were taught to chant this silent mantra when we walked. And that mantra was about our physiological being, right? That when we're anxious, the dog's going to be anxious. And so if I'm walking the dog and we see another dog, my body immediately tenses. The dog senses it and senses, oh no, I need to protect her. And so the mantra was, I'm the boss. I'm the boss, because physiologically it relaxed me so that the dog would not think he needed to protect me. So we were walking with both dogs. He had the nice older dog who was well behaved, and I had the not well behaved dog. And we went for a walk, and in the middle of the street, standing in the middle of the street, was a dog that's known for being aggressive. And I said out loud, and I was very pregnant. I said out loud, I am the boss. I am the boss. I am the boss. And my husband let go of the older dog who kind of just sat there, and he started chanting, "We're going to die. We're going to die. We're going to die." And he ran away. So I had both dogs, and the other dog walked away, and we were fine. It goes to show that that story shows, one, that physiological reaction that trauma brings. My husband was terrified, and still to this day, even though we are dog people, is fearful of certain dogs. So that dog was Pavlov's unconditional stimulus, right? That there was a threat of harm based on his history. He experienced trauma. His "I'm going to die" was an uncontrolled response, that fight or flight, and his was clearly flight. I thought it was an extreme reaction to a normal situation, but remember, I did not experience that trauma. So that I thought it was nuts, but that was his trauma. And so we all also remember that terrible experiment of little Albert. Remember, they conditioned Albert, who was 11 months and raised in a hospital, to be afraid of that white rat. Trauma for little Albert. He was never desensitized of his fear. And we really don't know if the fear remained, as he died when he was 6 years old of hydrocephalus. These are just some examples of trauma that are maybe a little bit different than what we're talking about in terms of the schools, but it's just an example of our own histories and what happens in our lives. So as we begin looking into the FBA process next, we have to remember that we may have beliefs about a particular student and their behavior, but more often the teacher or staff have beliefs regarding behaviors of that student. Behaviors are not about the individual, the family, the home, or the disability. They're about the environment and what's happening there. So this shifts the focus of something being wrong with the individual, what's wrong within the child that we cannot observe, to the actual behavior we can observe. So now our job is to focus on what antecedent or events are triggering behavior. Maybe it's the teacher's perfume. All things need to be considered. Then we alter the consequence, maintaining that behavior, and reinforce the desired behavior. I'm going to stop this slide for you to take a quiz before we move on to the functional behavior assessment part of this workshop.